I'm Brandon Anderson. I'm the program coordinator here at Salt Lake Community College for the Respiratory Department and program. I want to talk to you a little bit about our program here at Salt Lake Community College. It is a great program. Let's just start right there. It's a pretty quick program. It takes about 2 prereq semesters, and then our actual program is 4 semesters in length. It goes from fall to fall. We accept about 25 students per year, and that's growing every year. So it's been really fun to watch and enjoy watching our students come in every year. Respiratory therapy, a lot of people think it's just, us doing oxygen and giving treatments. That is really not the case. We do all of those things, but one of our biggest things we do is in intensive care. We're an actual bedside provider. Along with us and the nurses, we take care of the patients at the bedsides with direct hands-on care. In our labs here, we teach people how to do those things. So respiratory therapy is pretty much a educational-based program where you have to take classes and learn the things inside a classroom. And then you have a skills portion, which is skill-based, where we have to do it inside of a lab to teach you all those hands-on procedures so you can do those, perfect those, and be able to go into your community hospitals to actually do clinicals and put all of that learning into real atmosphere learning environments. At the end of your 4th semester, you get to end up taking your board exams, and when you graduate, you end up becoming a full-fledged respiratory therapist to be able to work in the community. Inside of our program, as we talked about the lab and preparing you to go to clinicals, one of the things you get to do is the first semester is pretty much learning-based. It's classroom and hands-on with our lab and skill-based requirements. In the 2nd and 3rd and 4th semesters, you actually get to do hospital clinicals, where you get to have a scheduled shift, 12 hours long. You're just like a normal employee. You get to go to every hospital that we get to schedule you through. You follow somebody. It's your preceptor. They teach you for the day. You get to follow them at the bedsides doing hands-on therapy in intensive care units, floor therapy. You get to see it, do it firsthand, and then you get to learn firsthand from your preceptor and from the environment. You get to bring it back to the school and get to build on those concepts each and every day.
My name is Joshua Lee. I'm a 4th semester student in the respiratory therapy program. This is my last semester, and so I'm getting ready to take my boards and get ready to pass those exams and getting ready to work on to moving into the medical field and working as a full-time respiratory care practitioner. I became interested in working in the medical field from a very young age. I always knew that I wanted to help other people. I had a lot of other jobs where I kind of felt like I was just a cog in the wheel and never really felt like anything that I did in my day made any difference for anybody. But working and studying to become a respiratory therapist has helped me realize that I can do a lot to help other people. There are people who are in hospitals and who are sick that need help that we as respiratory therapists can give to them because they are in just a bad place in their lives right now, and the care and the comfort that we're able to provide to them helps them in their lifestyle and in their life just be so much more healthy and have that hope that they can get better. So my typical day in the health science program includes a lot of studying and a lot of preparation for my career. I have classes once a week right now as a 4th semester student, and then throughout the week I have different shifts at hospitals that allow me to go and practice direct patient care. When I'm at the hospitals, I have somebody who is with me 24/7, and those preceptors that are with me help me understand the things that I don't know, and they help give me that experience that I wouldn't be able to get from a book or from a lab experience. Getting that direct patient care has helped me understand so many of the principles that I've studied in my class and in my book work and helped me prepare for this career. So right now during the pandemic, it's unprecedented that we as students have been hired at certain facilities to work as respiratory care apprentices. And that means that we are in the hospitals and we are working alongside fully certified and fully trained respiratory therapists to provide that direct patient care to patients. We've been able to go in and work side by side with these people who need our help, and it's been a really great experience. and it's helping me prepare to pass my exams at the end of the semester by giving me more experience than what I would get from book work. So working in the medical field allows me to achieve a work-life balance that I never really had before. I've been through lots of years of college and working through different jobs to kind of keep my life and going and help support my family, but it hasn't been until this point where I really felt like I've been able to really have that balance between school, work, and the rest of my life. And once the program is done, I'll be able to have a balance between my life and my work that I never really had before. Respiratory therapy isn't an 8 to 5 days a week kind of a job, but the days that I am at the hospital working allows me to really enjoy the rest of the time off that I get away from the hospital. It allows me to recharge and allows me to keep going on a week-to-week basis. In this field where we are taking care of other people, we can't forget to take care of ourselves, and that's been really made apparent by the pandemic this year. I'm finally at a point where I feel like I'm really achieving a great balance between work, life, and school, and I'm happy to be done with school here in a little bit so that I can finish this and start the rest of my career.
I'm Savannah Anderson. I'm in the Respiratory Therapy program here at Salt Lake Community College, and I'm in my first year. The reason why I picked respiratory therapy is my family has background in the medical field, so I always knew I wanted to go into the medical field. And I picked respiratory therapy specifically. When I got here at SLCC, I took multiple intro classes to health sciences. So I took intro to nursing, intro to radiology tech, and then intro to respiratory therapy. And out of all of them, I felt respiratory therapy was best fit for me and what I wanted in my future. I was very lucky, being that my family had already had some medical background, that I was able to shadow while I was still taking intro classes. So I was able to shadow a respiratory therapist, a nurse, and a radiation technician, and ultimately respiratory therapy was what I picked. But if you have the opportunity to shadow prior to picking your degree, I would highly recommend doing that. It's a great opportunity.
My name is Jana Hudspeth. I am a first-year student here at Salt Lake Community College in the Respiratory Therapy program. I'm really excited to get to be part of such an awesome adventure in this program, and my plan is to work in a hospital in a respiratory unit when I graduate in a year. So I'm not the typical student. I actually am going to give away my age a little bit. I graduated a long time ago, and so I hadn't taken any college courses in between high school, and I had to go back and take some refresher classes that you would have had in high school in order to get into the program. So it took me a little longer than normal to get into the program, but I'm really grateful that I did and did the work to get here. So if there's anything that I could do to change to make the transition easier, I would have definitely continued my education beyond high school, or even just taken some refresher classes. But honestly, it wasn't overly hard to get in. The prerequisites are great, and I felt like it really enlightened me, and hopefully I won't have Alzheimer's now as I'm getting older.